I'm your host, Josh Green, Senator from the Big Island, ER Doc, and a member of the Hawaii IPA. Today I'm hosting a program with three excellent individuals. We're going to speak about dengue fever in Hawaii. As many of you know, we've seen a lot of this in the newspaper, and if you're on Big Island, you've experienced firsthand what some of the concerns are. We've had an outbreak of dengue fever, and we have the experts today to talk about it. At last count, on the website, I saw there were, I believe, 56 cases that had been confirmed. We'll get some updated numbers, we'll talk about the disease, and we'll find out if we're doing what we need to, which I believe we are in the state, how we're going to deal with it going forward, and we'd like to provide a lot of information for you out there to know that this is a safe situation, but we have experts in the state working on it. So first I'm joined to my left by Dr. Sarah Park. Sarah, if I remember correctly, went to MIT. She's our Chief of Disease Outbreak Control Division and our state epidemiologist. These titles have a bit of a lengthy verbiage, but she's been our expert on infectious disease for years. Then to her left, we have Lynn Nakasone, who's the Chief of Environmental Health Services Division. Thank you for being here, Lynn. Who also is engaged in vector control. So she's going to be talking about what we're doing for mosquitoes and how the state's dealing with that. And then finally, a good friend of mine, Dr. Richard Creagan. Richard's physician has worked in the emergency departments over the years, but is now a representative and elected official. Also, just coincidentally, from the Big Island, we have a district that overlaps quite a lot. It's the South Kona area in Ka'u.
All right, thank you.
Okay, so thank you everyone for being here.
Thank you.
So an outbreak of dengue fever on the Big Island. Mm-hmm. Sarah, if we could start with you, why don't you kind of give us the lowdown? What does that mean? What is dengue fever, the basics?
So, I mean, dengue fever is one of quite a few, actually, mosquito-borne viruses. That means that the transmission of that disease is accomplished by mosquitoes biting a human being, infected mosquitoes biting a human being, as opposed to, I think most people tend to think about the human-to-human diseases, you know, the foodborne kind of diseases or respiratory diseases. This is a different kind of disease in that it's the mosquitoes, the vectors. On the mainland, they're familiar with their own kind of mosquito-borne disease, West Nile, a slightly different disease. Okay. In Hawaii and in much of the Pacific, much of the world actually, in Asia, in Latin America, dengue tends to be a bigger concern. And it's actually a globally increasing concern, somewhat related to climate change issues. But in Hawaii specifically, we're not what we would call endemic for dengue, in that we don't commonly think of our mosquitoes as carrying dengue on a regular basis. Right. However, we've always known, as in, again, many parts of the world, we have the mosquitoes that can transmit the disease should they become infected. Right. And the way they become infected is if a traveler comes in, one of our returning residents or a visitor who's infected, who's ill and gets infected or gets bit by one of our mosquitoes. That mosquito incubates the virus just like we would incubate an infection. Yes. And then once they're infected, they can then start transmitting to other people when they bite on them. And so what we have here is essentially that's what's happened is at some point somewhere, probably early September, so at least, possibly earlier, we're not sure exactly when, someone came to Hawaii, whether a returning resident or visitor, who was sick with dengue, got bit by one of our mosquitoes, that started a chain of transmission, and you know, that now we're ending up with a dengue fever outbreak. Right. Now, you know, people in Hawaii are familiar with, you know, having seen outbreak, unfortunately, previously, Maui 2001, which, by the way, wasn't just Maui. It overshadowed, actually, concurrent outbreaks on Oahu and Kauai, separate introductions, and then 2011 on Oahu again. So the thing is that from public health perspective, you know, we've always been advocating good mosquito control, and my colleague over here can talk more on that issue. Right. Because of the risk, you know, the risk always exists for having dengue fever, chikungunya, Zika. These are some of the other kinds of viruses these mosquitoes can carry, be introduced to Hawaii and cause outbreaks like this. And every outbreak is just a little bit different. You know, the conditions, the people that are involved, the locations, the control measures that potentially could be employed. But right now we're in the midst of this dengue fever outbreak, where the most important thing is really that people, again, follow the recommendations that we've been talking about, is control the mosquito breeding sites in and around your home,
Right.
around businesses, and prevent getting bit. So hence our public health education campaign, the Fight the Bite campaign.
Which is very good. I recommend people, might as well say this a few times today, you should go to the website, right, the Department of Health website, and it's very easy to navigate. You see it there, and you quickly, there's several links. One of them is Fight the Bite and
Right.
frequently asked questions.
Right.
Hopefully people will hear all of these things, I would guess, from us today in our 45 minutes together, but know that resource is there. Why don't we go to you, Lynn? Dr. Park has talked a little bit about what an outbreak looks like, and we have these cases. Now, could you give us an update on the number of cases and kind of the general area of where they are?
Actually, I would
You want to defer to her?
Yeah.
Too? Okay, that's good, okay.
Well, number of cases, because Lynn actually can talk to probably the mosquito issues
Okay.
specifically much better than I could, and I would defer to her on that one.
Okay.
But in the number of cases we're up to now, I'm glad you asked
Yes.
that. Actually, as of today, is 65. Latest onset of illness, that is, when we say onset of illness, that's the first day of symptoms.
Yes.
Many healthcare providers are very, used to that kind of lingo, if you will, but
Right.
I'm sure the lay public I've heard have had some confusion. That actually is a very important measure for us when we're doing a disease investigation, especially something like this,
Right.
because we want to know what was the latest point at which a person first became ill. Because then we want to know, we know from the disease where, how far back from, we consider the incubation period, so to speak, the time.
Which is about 5 to 7 days from a
It's
bite?
about, yeah, we estimate about a week. It actually can be a little longer, it can be a little shorter, but we estimate about a week back from when they had that first day of symptoms, and that is the point of last known disease transmission. So that's why that last date is always important. And I think it's important for the public to understand that while the case numbers are increasing, and frankly, I fully expect them to increase, awareness is high, people are seeing their clinicians.
Right.
We're hearing a lot about older cases, so we're picking up more than otherwise might fly under the radar. But more importantly, while the case numbers are increasing, many of them are old cases. If you looked at our data, you would see that the onsets of illness of many of our cases really fall in the month of October. So that's where you see most of the disease activity. And honestly, that should not be too surprising. Again, this is a mosquito-borne transmission. What do people in Hawaii normally do about mosquitoes? We think of them as nuisances. So do you wear DEET on a regular basis?
No, almost
Do
never.
you wear long sleeve? Do you take an effort to really inspect your property on a regular basis for standing water? So you can imagine, people aren't regularly practicing those measures, which they should, and that's actually what we're trying to advocate for, is even after this outbreak is done, that you do this. And again, Lynn can speak more on those kind of measures. But, up until we were notified about this, about a potential outbreak, and got the news out to people, people weren't practicing those measures. So up until that point, I fully expect there were a number of cases. After that point, from the time that we got the medical advisories out, the press release out, started the community meetings.
You think they'll start dropping off?
That they are already, what we're seeing is trickling. And
Okay.
I expect that trickle of cases to continue for a while until we have full saturation of the message out to the public.
Right.
And most importantly, that the public actually follows the recommendations to the T and makes it routine for us on a day in, day out basis.
Let's go, let's spend a minute or two, if we can, with you, Lynn. Why don't you tell us, what are the core recommendations to control mosquitoes so that we do not have infected mosquitoes infecting our people? And then I want to go to Richard to hear, what are you hearing from patients and people and constituents in the community?
The best way to control the mosquitoes is to control the breeding. So you want to make sure there's no standing water so that mosquitoes can breed.
Right.
You eliminate the breeding sources or the breeding sites, then you essentially interrupt the breeding cycle, so
Right.
to speak, so you don't have the mosquitoes. So what we're advocating essentially is to for people to go on their property, find anything that can hold standing water. It can be some like a toy, bird baths, old tires.
A plant that holds water like that, yeah.
Anything, and just routinely turn it over, And if it's something very large, like a big planter, that has a, base that collects water, you can just, shoot a couple, or put a little bit of soapy water in it, and that would,
Just regular soap, like
Yeah.
dish soap? Okay.
like Dawn or whatever. What it does is that the mosquitoes don't like it, so they don't breed in that kind of environment. So, if anything, that's our basic message that we would like people to do, is that they have the power to do something for themselves to ensure that they don't get ill.
Okay.
Simple things is that if you have, mosquitoes like to come out, early morning and late afternoon. So if you have to be outdoors during that time period, wear long sleeves, long pants.
Did I hear light colored clothing as
Light
well?
color is good too. Mosquitoes are attracted to dark colors. So
Right.
if you wear light colors, that's also a means to protect yourself. And then use mosquito repellent. We recommend anything from 20% to 30% that has DEET in it.
This is, I think, an important point. We have plenty of time here today, but I wonder, I know that when there was the initial scare and the initial cases, people rushed out and got a lot of mosquito repellent, and then I think pretty much stores, we were hearing, stores
We had a
had low
functional
supply,
shortage.
right? So I have seen a little bit of email back and forth. I think there's shipments coming in, or some people donated. Could you give us an update on that?
I believe that we're getting additional shipments into to the Big Island through, I think, KTA and CBS.
Okay.
However, I would just say that that's something, an example of the great collaboration going on with the state and the county.
Yes.
The county has really taken this on, and I would really defer those kind of things to the county, because they've said, they've vested in their folks, and they said, we'll take care of this. So we actually are focusing on supporting them in their efforts and responding, because both entities, we recognize we have a public health responsibility in the Department of Health.
Right.
To deal with the investigation, to talk, to provide the recommendations regarding mosquitoes and appropriate abatement issues. But the county is the one that has to deal with all the civic responsibilities that are essentially sort of indirectly or directly related to the public health issue.
Right.
And so on the repellent issue, they've taken it on, and they are coordinating. And we basically, when we get information, we forward it on to them, and they assure, they try to make sure that there's appropriate repellent on the island. And so when we hear about any messages of concern that there's shortage here or there, we forward it on to the county.
Right, and they've been very responsive.
Very
also.
responsive.
So let me go to you, Richard. So
Okay.
you wear both hats. You're a doc, and you also have had a lot of experience in the community, both even in agriculture as a farmer. What have you been hearing from people in the community on the Big Island?
Well, what I've been hearing is that in some ways they're confused about the risks, they're confused about what they should do, and they've been struggling with finding doctors to see them. They're struggling finding places to go, and they're finding many of their neighbors or workers for their neighbors are reluctant to go to medical care, to seek medical care. And so they're basically staying up in the coffee lands and not coming down and not being tested. So, there's a concern that there's potentially a number of people out there that, maybe they're not ill anymore, but they were ill. And how important is it going to be to identify those cases and other cases that are similar to that going forward, who just aren't, they don't have doctors, they don't have resources. How do we direct resources? Now, we've suggested that the health department, just as they would in, say, a smallpox epidemic, would go out and identify the cases, do ring vaccination, that kind of stuff. So things like that where, in this case, to me, it was deemed prudent, maybe overreactive, but, proactive to go out, and seek out the people, not do a door-to-door thing, but when someone calls and says, hey, I think I have dengue, you say, okay, how are you feeling? Well, I really feel bad. I don't feel like going anywhere. Well, why don't we come out and see you, evaluate you, get some blood, and make some recommendations to you, and maybe provide a way for you to contact us if you don't have a cell phone or something, that kind of thing. Because there are a lot of people who are very isolated out in the boonies on this island, on the Big Island anyway, and we want to reach them proactively. I mean, how we reach them proactively, whether it's these teams we've been talking about, or you know, what method that would be, I don't know, but I think we need to reach more people than we have been reaching, and that's what I've been hearing, not only from the people who haven't been reached, but the people who, you know, are concerned about their neighbors who just aren't seeking medical care.
Sure.
We have another 30 seconds before our first break, but please,
Okay.
go ahead, Sarah.
I was just gonna, well, maybe 30 seconds isn't enough to talk to
Okay.
answer some of that.
Okay, why don't we do that? I appreciate, so we've, basically, this has been very good help right out of the gate. So if I may summarize, we have a dengue fever outbreak, which is all over, is over a large part of the world. In my reading, as many as a couple 100 million cases a year.
Right. Not an outbreak, but dengue fever is.
Dengue fever in tropical areas
Right.
particularly. Someone came to the state of Hawaii, probably infected, maybe not symptomatic yet, but during their time here.
Could have had mild infection.
Right,
How
could have
many
had-
people don't go into work when they're sick?
Sure, so mild
Probably.
flu symptoms, or even could have been quite sick and gotten quite feverish, and we'll talk more about the presentation in our next segment. But they were bitten by a mosquito. That mosquito now was able to pass on the infection, and then clusters of people became infected on the Big Island. Vector control is working hard to make sure that we know to get rid of mosquitoes on your property, no freestanding water, wear bug repellent, and cover up in the morning and afternoon hours, please, so you can avoid having more mosquitoes become infected. And then finally, we're still continuing to dialogue with the community to make sure that, number one recommendation, if you have the capacity, go see your doctor or nurse practitioner who you have caring for you, or to the hospital if you're very sick, or to the community health center in Kona. But we're still going to talk more about, how can we get all of the cases enumerated. But that's kind of an overview for our first 15 minutes. We're going to take a break now. I'm Josh Green, your host at Healthcare in Hawaii on ThinkTech, talking about dengue fever. Thanks for joining us.
Hi, I'm Ethan Allen. I host Likeable Science on ThinkTech Hawaii, and I do this because I care about science literacy in Hawaii. I want to spread the understanding that science is a vital and interesting part of everyone's life. I want to make sure the broadest possible spectrum of people understand the beauty and the value of science and realize that science plays out each and every day of their lives. I want you to understand that science is fun. So we bring onto this show each week guests who are scientists, from astronomers to zoologists, and we talk about what they do and how they do it. But most importantly, we talk about why you should care about their work, why you should see that their work has value and impact on your life. So I hope you'll join us Fridays, 1 p.m. here on ThinkTech Hawaii. You can watch us via live stream. You can watch us recorded on Olelo, and you can see us each week. We hope you'll join us.
Aloha, welcome back to Healthcare in Hawaii. My name is Josh Green. I'm an ER physician on the Big Island and serve as senator at the legislature. I'm joined today by individuals, two individuals from our Department of Health, Dr. Sarah Park and Lynn Nakasone, who are experts on infectious disease and how we deal with it in our state. And I'm also joined by a good friend, Richard Creagan, who is a physician and also serves in the legislature and represents the Big Island. We're talking about dengue fever because we've had an outbreak on Big Island. Dr. Park was able to share with us that the case number is 65 confirmed cases right now. Dengue fever is all over the globe, and it affects people from a moderate disease, low-grade fevers, feeling kind of achy, to sometimes severe illness. In some cases, people have very high fevers. They can, under very rare circumstances, develop complications from dengue fever. We haven't had any fatalities, which is I'm really grateful to hear. But people have been concerned, and they're getting tested and in the press. When people get dengue fever, they can have fevers upwards of 104, very high fevers. They will feel exhausted. They will often have a headache, severe headache. One of the classic symptoms is behind the eyes, to have severe headache behind the eyes. The description of dengue fever, I think its translation is bone-breaking fever.
Well, it's not a translation, it's just another name.
Okay.
It actually used to be just commonly called breakbone fever.
Breakbone fever.
And related to aches and pains,
There you go.
bone aches, muscle aches that accompany it. Quite severe, actually, usually.
So when people have these symptoms, and I think it's been very well pointed out, these are symptoms not only of of dengue fever, but they can be symptoms of chikungunya, another virus. They can be symptoms of a bacterial infection like leptospirosis. So when we have talked openly about looking at the disease, we tell people still, if you feel these symptoms, it's always good at least to speak to your healthcare provider.
Right.
So that's very important basics. And we were talking in our first segment at the end, Richard was speaking candidly about what he's heard in the community. And I wanted to ask your opinion about that. I read in the newspaper that there was maybe some concern that we have a lot of migrant workers picking coffee that might not be getting tested, or they might not avail themselves of testing because whatever, they poor, or they are not linked into our health system, or maybe they can't find a primary care doc. So kind of along those lines, how would you respond to what Richard said about, can we get everybody tested? Should we get everybody tested?
Sure.
What's the best way?
Sure, and you know, I think it's a valid concern. We share it actually in the, I mean, I've always been concerned with every outbreak. We always are concerned about, are we reaching everyone with a message? And as I said earlier, in order to control this outbreak, until we actually have full saturation of the entire public understanding and acting together as a community, as we in Hawaii usually do, to try and protect ourselves, we won't see an end to this outbreak, you know, as long as one person continues to get bitten out there. And so we want to make certain that this message reaches the communities throughout the state, not just the Big Island. But yes, there are some areas where there are at-risk populations, not just the migrant workers. Actually, we're aware of several different groups on the Big Island as well as throughout the state where, you know, there isn't great penetration of traditional media. I mean, I bet they're not watching this, for instance.
No.
So hence, we've employed our partners. You know, we've employed people who've had experience in the past with community outreach, hence Dr. Pang from Maui, the district health officer. Our director asked him to come over for a short time to help out our district health officer, Erin Ueno, on the Big Island in terms of the community outreach, specifically for that purpose, to try and help find some of these communities and help sort of bridge that gap with them, make that relationship happen. And so we are working both with the county very, very closely, actually. We're letting them take the lead because they know their island best, you know, and so we're letting them tell us, you know, where the areas and how can we support them in reaching those areas. We're also reaching out, I think I mentioned earlier to you, separately in another conversation about the fact that I'm reaching out to the healthcare professionals, you know, especially on the Big Island. And, you know, just last night I was on a conference call with the chief medical officers of the neighborhood health centers on the Big Island to discuss this whole issue of healthcare access. How do we assure that? And they all assured me, 2-1, that, you know, that basically anyone who walks in the doors of their neighborhood health centers, they would make certain that those persons, regardless of ability to pay, would get appropriate care. You know, and another set of folks that I've been reaching out to, my director and I have been reaching out to, is the Healthcare Association of Hawaii, you know, that represent all the healthcare facilities, and ask them to consider how can they also help, you know. So public health's role is really to facilitate access to healthcare. And this outbreak, you know, unfortunately has really served to sort of shine a beacon light on the bigger root cause issue in Hawaii as a whole, which is the healthcare crisis. You know, the fact that, especially on the Big Island, we have a shortage of primary care physicians and nurses and physician assistants. And so this is a definite concern on the part of our director, on the part of the governor. And so we're working together. You know, our solution right now is, in the acute term, is to try to reach out to all our partners to try to address this issue. It's not going to be perfect, admittedly, but we are trying and bridge those gaps and make the relationships work so that, you know, at different levels, different areas, we can try to start to address this.
What new, I hear what you're saying. I mean, the collaboration is critical. The kind of things that I'm hearing, which belies your point, do create some challenges, though, because I'm wondering just how many people we ultimately, thank goodness no one's going to die, or hopefully, you know, not going to die. I mean, it can be a severe form of dengue fever, but in that case, we do expect people are going to end up in the emergency department and get care. So my concern, though, is there are these real fundamental impediments that we've been working on for years, trying to get people, even in Oahu, we have these healthcare challenges as far as access go, and it just gets significantly worse as you get concentrically further away, which, you know, Richard will definitely point out too. But we've got any number of challenges that people can't get into the health centers. I had it today, and they're wonderful at the community health center in Kona, for instance, but an individual couldn't get their kid seen because the father had no identification. That was a technical problem, they didn't get seen. Another individual has some legal problems, and they've had a bad past in their past, and they're concerned. They don't want to avail themselves of coming out of the woods, so to speak. And on some level, I'm just wondering, this is just like a kind of a lay opinion almost, not my physician opinion. I'm just wondering, at what point do we throw out some of the old models temporarily and say, okay, we need to test 500 additional people so we know.
So you
How
bring
do
up
do that?
another, right,
Yeah.
another a separate issue is do we have to test everyone, you know,
Maybe
is it
not,
really
yeah.
the valid thing? I mean, and you know, Richard had brought up the smallpox issue. You know, again, smallpox is a very different disease, and as I said earlier, just about dengue outbreaks, every outbreak is different. Same thing here. Every disease is different, so the response is going to be very different.
Can you,
know?
can you,
So
I understand you, no question about that, and obviously when we had the discussion about Ebola, and we didn't have any cases, we hope to never have any cases,
Right.
totally different. But so let me ask you a couple rapid fire questions. Anyone feel
sure,
free to
but
chime
can
in?
I just finish a thought here?
Well, but it can't go for 20 minutes because I only have a few
No,
minutes.
it's not going to be
Okay,
20 minutes.
yeah.
I was just going to say that as far as screening every single person, you know, it's not possible, even during a pandemic
Right.
situation. The idea is that you test those who really need the test for their care.
Yes.
And we know that there are going to be many more that are just not going to come to light, whether they are not willing to or we're just not able to reach them.
Well, let me ask
But
you-
we have to try to reach those who really need the medical care.
Right, I totally agree. How much more, open question, how much more data would be helpful so that you could characterize the scope of the disease? Let me ask you, and we can each chime in. Do we need to know, though, do we have to have 3,000 tests, of which many are
No,
negative? Do we
no.
need more? I need to know, like, can you extrapolate from the
I
number
can't
of
give
cases?
you a number right now, like I need 100 or 200. It doesn't work that way. What it is that as time goes on and we do collect the case information, I mean, you're seeing it, the public is seeing it, in that in the early days of this outbreak, you know, just a few weeks ago, all we could tell you was that we had, you know, X number of individuals who came to light to us that we investigated further, and this is what it looked like in terms of, it looked like the earliest onset was in mid-September, you know, and that's all we had at that point. Then jump forward another week, and suddenly we're like, okay, well now this is what it looks like. It looks like we're worried about certain areas of the island. Jump forward another week or so, and then now we can actually develop a map. You know, so with each week we're getting more data, we're able to refine it further and further, and I would say at this point, you know, we're able to pretty much get a decent picture of what it's starting to look like. And as I said, the bulk of our cases were in October. Now, will we ever find that index case? You know, highly doubtful, honestly, because it's very difficult. You have to piecemeal.
I'm going to interrupt you. I want to go to
Yeah.
other people here. Richard, so as you hear this, just tell me, riff with us, what is your
Okay.
feeling about the response? And
Well, I mean, in terms of testing, one of the things people have voiced a concern about, because we've raised the concern with them, is that first-time dengue is a different beast from second-time dengue, especially if it's a second strain, okay? Because you're not going to get it second time if it's the first strain. At least you're not likely to. So the goal, in my mind, one of the goals of this outbreak should be letting people know if they've had type 1 dengue that they did in fact have type 1 dengue, so that if they go to a country with type 2 dengue, they know they had a different type, and they might take extra precautions in going to that country or not go to that country. So I think there's a real good role.
Is it valuable that we do that now, or is that that testing now, or is that something that, as we deal with the
Right.
emergent outbreak, that we gradually get people in? I don't know. What's the?
I mean, the
feeling?
samples could be taken and not all tested immediately if there's a glut in the testing, you know, queue. that they could be tested later, they'd identified and tested later, so that those people would know that valuable information that they had type 1 dengue or type whatever, or
True.
leptospirosis,
However,
or
it's not as
chikungunya.
simple as that, because we also have population that probably already were infected and, you know, they came from another country,
Sure.
they've traveled before.
But then they didn't have
So
that
that's-
information.
it
They
just
probably don't have that
becomes- It just
information.
becomes that much more complicated. So for the purposes of this outbreak right now, and really the bigger concern is making certain that people who are ill get the appropriate medical care, because frankly, even with an outbreak, I will guarantee you that there are going to be more cases of other types of illness. And the tragedy would be is if someone actually had leptospirosis, for example,
Right.
which is much more common. And by the way, Big Island always contributes the most cases
Right.
annually of leptospirosis in the state.
Yeah.
You know, so the tragedy would be that that case is missed because everyone is so focused on dengue, and that is a treatable infection.
that-
How would
but
you
that-
miss,
but
how
that
would you
person-
detect that
If that
case?
person doesn't get tested, so if that person is not assessed fully by a trained, experienced medical professional, and all they're doing is they're interested about getting tested, that, you know, as a physician, if you were presented with a patient and they came to you and said, no, don't pay attention to anything else in my history, all I want is you to test me for this particular thing, and that's all I'm interested in.
Which is not at all what we've been proposing, just so you know. 'Cause
Right.
that's been
But-
no, no, no,
but
no, no, no,
it's
no,
not
let me-
what I'm
forgive
not
me, this is-
saying,
Let
but-
me finish
yeah.
my thought. This is my program. Okay, Sarah.
Mhm.
So that has been a gross and unfair misrepresentation. When I saw those comments, I was quite upset, because what Richard and I and others have said is right now, for people to understand the Big Island, okay, you have a pretty good understanding.
Mhm.
The people that we're speaking of are getting no testing and
Mhm.
no health care.
Mhm.
So to get any help from a public health official or a nurse or a physician or whomever is, first of all, an improvement. And it was never recommended that we would just show up with a checkbox, please get your dengue fever, and not tell us
Right.
about your history. The goal, of course, would be to get them comprehensive assessment and
Exactly.
referral. And that's what we're proposing. But right now, I think what's
There's a
being
struggle,
expressed-
there's a gap,
Yes.
and I think we're all on the same page on that
Right.
one, and I think you're right. What has been suggested by different people is getting, you know, translated differently than what was intended. And I think it is important, we all agree, it is important for people to get a full comprehensive care, to get a full comprehensive assessment, to make sure that we're not missing something that even potentially is not an infectious disease.
Right.
It's some other underlying issue.
For sure.
And that these people are hooked into regular medical care in the future, because if this is an ongoing problem that is recognized with them, maybe they do have dengue, but there are other issues. Maybe they do have dengue and it progresses to something more severe, maybe not severe dengue, but maybe it's dengue infection that requires hospitalization, but all they wanted was the test, you know, and that's the problem. But again, getting back to the gap issue, that's why we're working so hard to try and work with all the partners on the Big Island as well as across the state to try and come up with multiple different solutions, because one size does not fit all. So yes, I'm talking with the neighborhood health centers, I'm talking with the healthcare facilities, the Healthcare Association of Hawaii. We're also talking with the county on how can we utilize EMS teams potentially. You know, we're offering to in-service them to try and help with assessments of some of the at-risk populations.
I hear you. So I think that.
So we're
I think-
working on multiple levels
no
and
doubt.
multiple areas to try to address this, and the
point that-
problem
the
is
point
it's
that's-
not gonna be,
The point that's being made.
you know,
the point-
100%
the point-
solution.
Of course not. The point that's being made is that those systems, and I don't think the people in Oahu, yourself included, understand completely, that those systems, we know there is a physician healthcare shortage, but those systems don't penetrate into parts of the state, and we are now in a different situation. We have our healthcare system with an outbreak, and so I think the point that Dr. Creagan was making, what Richard was making, was this is a moment where you have to penetrate additionally, and you have to push some people out of their comfort zone, because not only do we want to help the Department of Health to know the full scope and the locations where the infection has been an outbreak,
Right.
of course, we're all on the same page there, but also there could be some long-term concerns, additional concerns, now that we have an additional cluster of people that have been affected by dengue fever. I think that that's what Richard was addressing when he was saying, over time, finding out some of these people have been tested positive, and maybe this is an opportunity to get them into the healthcare system.
if you're referring to the added cases today, they're not additional cluster, it's just cases
I'm,
that
I'm,
were
refer-
old
I'm,
cases.
I'm referring to the outbreak overall.
Right.
So
But I think it's
we're at
important
a brief
to
outbreak.
understand.
We're gonna talk
Okay.
15 more minutes, okay? I'm gonna take a brief pause here because we just have to for our program.
Sure.
We'll take a very brief break. I'm Josh Green with Healthcare in Hawaii. We're talking about dengue fever in our state.
Aloha, this is Keli'i Akina, president of the Grassroot Institute, and I want to thank you for watching ThinkTech Hawaii. We are delighted to be partners with ThinkTech because it gives us the opportunity to bring to you a show every week on Monday at 2:00 p.m. called Ehana Kako. Ehana Kako means let's work together because we believe that Hawaii will be a better place when everybody works together. And in what way? Well, at the Grassroot Institute, we research 3 basic areas and we invite guests to come on board from across the country, the state, and the nation to talk about a better economy, a better government, a better society. Now, aren't those things we all want? Indeed. If you'd like to have the latest research in terms of public policy, as well as ways in which we can build a better government, economy, and society, then tune in every Monday on ThinkTech Hawaii at 2:00 p.m. for our fascinating guests on Ehana Kako. Let's work together. I'm Keli'i Akina with the Grassroot Institute, and I'll see you then. Aloha.
Aloha. Welcome back to Healthcare in Hawaii. We have about 10 minutes left in our program on dengue fever in the state of Hawaii. We have 65 cases. I'm now going to pivot to Lynn Nakasone. You are the chief of the Environmental Health Services Division. Your goal, we want to focus on this for a moment, is to make sure that we get rid of the mosquitoes, and that's how we're going to beat this crisis. What are the key top points that you want people out there to know?
Just to repeat myself again, is that get rid of standing water. That is the main thing that people can do. Getting rid of standing water and protecting yourself. I think those are the very key things that people should take away from this program. That there is things that they can do to help themselves. And the main thing is just go through your property, make sure there's no standing water. There is, if you have bromeliads or plants that collect water, spray them with soapy water. And try to do this on a routine basis because this is something that we need to do on an everyday basis. We want to control mosquitoes, not just for now, but forever, you know, as much as we can.
Yes.
People think mosquitoes are more like just a nuisance, and they can be, but they also can be reservoirs for disease. So if we can knock down the population of the mosquitoes as much as we can, then that also decreases the potential of getting diseases.
That's very helpful. So I'm going to go back to you, Richard. What are your primary concerns? I think people have been very well spoken about getting rid of the mosquito vector.
Right.
You're sitting there now. We're partway into this outbreak.
Right.
What are you thinking when you're thinking about the dengue fever outbreak?
Well, you know, one of the things, one of my big concerns is whether this dengue could become endemic on the Big Island. You know, now, Paul Loeffler has quoted Dr. Gruber, an expert Gubler, sorry, I don't know him personally, so Gubler, as saying that if you just have albopictus, it's very unlikely for dengue to become endemic anywhere. But if you have Aedes aegypti, it could become endemic. The Big Island is the only place that you know I know has Aedes aegypti, but I haven't been able to localize the maps of where those are, and I doubt they're up to date. So I, would like to know. I think the people should know where Aedes aegypti are, because certainly if they think they're infectious, they shouldn't go near those foci.
These, just for our audience, the Aedes aegypti are the mosquito.
Right.
That
Which bites more than one time,
okay.
and is a much more aggressive vector of the disease.
Lynn, can you comment on what knowledge do we have about
Because
where
Canada
these...
was the focus of
Yes.
aegypti, and we know that.
So that was one area. So just to give people an overview, and correct me if I'm wrong here, the focus does appear to be in the South Kona area, okay?
One
and
of them,
One
right,
of the
a
areas.
major one.
Right, though we're worried about the entire Big Island, as
Right.
I've read on numerous occasions. In reference, though, to what Richard is saying, where do we know where there are areas of focus of this particular mosquito?
We have historical data, right? As far as current data, because of the layoffs and cutbacks of the vector control program, the continuing surveillance of the mosquitoes on all islands have been curtailed very
Historically,
drastically.
where have they been? And then we'll do our best going forward. Where are they on the Big Island historically?
On the
In the
Kona
southern-
side,
okay.
on the South Kona side, so.
Let me just ask a general question, because I don't know the answer to this. Are there possible clusters of these mosquitoes in other parts of the Big Island? Could they be in Hilo as well, or wherever, Waikoloa? Is that possible, or is that unlikely?
It is possible. I mean, I have to be honest, I have to say it is possible. We don't have a good grasp of the current population of Aedes aegypti.
And to get that, having more people in the Vector Control Division would be very helpful to you and Dr. Park, because then when there's not an outbreak, you can be assessing where these mosquitoes
Mhm.
are,
Yeah.
and then using all the same logic you said before. We still want to kill mosquitoes, any kind of mosquitoes, because other mosquitoes can convey malaria or convey, thank goodness, not seeing this now, yellow
Right.
fever and
Right.
chikungunya
Chikungunya
is a
and
scary
Zika.
one.
Yeah.
Yeah. So these are there's plenty of reasons I think people should take home from
Right.
today to get rid of the mosquitoes.
Right,
and
and not just on Big Island, but the entire
Entire state.
state
Right.
on a regular basis. I mean, the recent Oahu case that we confirmed is just an example. We see introductions
Right.
of potential dengue all the time on a regular basis because we all like to travel.
Right.
And we get a lot of visitors.
Right.
So, the focus really, in terms of if, people ask me, how is this outbreak going to end? It's only going to end if, as my colleague here says, we make sure that there's no area that mosquitoes can survive in the state. We take that precaution around where we live, around where we work. These are day-biting mosquitoes, so especially where we work, where we hang out during the day. Those are all important things, and we have to continue to practice that.
And then, Richard, because we're going to come to the end of our program soon, you've got a lot of contact, as of course do I, in our district back home. What are you hoping to convey to people in addition to this very clear message to eradicate any mosquitoes and wear protective, mosquito repellent and clothing? Healthcare, from a healthcare perspective, if someone gets sick, what are you worried about in the community?
Well, I also worry about leptospirosis, and during that time I was in practice, there wasn't enough. The testing took so long that the best testing was a blood culture, because if you got it while the patient was febrile, the culture was often positive within a couple days. Then you knew, and you could treat them empirically, waiting for the culture. That was the best positive test. It
But
often took months.
today, when you
otherwise.
get a call from somebody with
Yeah.
a fever,
Sure.
you're telling them to do
Well,
what?
Okay, if I said, look, at this point, the community health centers have been mobilized, right? If you have a ability to get there, I think the risk of transiting, even if you're viremic, is outweighed by the benefit of you getting treated and evaluated, right? And because, frankly, fortunately, this is type 1 dengue, and most of the previous people who know of their exposure are type 1. So you're not going to be a tremendous risk to other people going to the healthcare center. So if they can do that, that's what I would advise. And hopefully, and I think we're getting to the point where, with your help mobilizing those healthcare centers, people are going to be able to be seen in they're not going to be sitting in an ER outside where there's mosquitoes, for 5 hours the way they have in the past. That's got to stop.
Let me, we're going to come to a close very quickly, but let me just sum up. Okay, so there's been an outbreak of dengue fever, which happens globally. We're not accustomed to a lot of outbreaks. We've had a few over the years. A couple, I think, were mentioned dating back to the early part of last century, the 1900s. We know that we had some cases in 2001, Maui, and other parts of the state, right before 9/11, I believe.
Yeah, we're actually right after, which complicated things even more.
Yes, and then we had some cases in 2011 in Pearl City, and then we now have these 65 cases, and the cases will increase. But we have to focus on the essentials. If you have property, or if you're outdoors, you don't want to be near standing water. You want to get rid of the standing water because that's where mosquitoes breed, particularly in the southern part of the Big Island, but anywhere in the state, because we want to get rid of mosquitoes, number one. Wear repellent, number two. 3, if you're sick, contact your healthcare provider, and they will advise you whether it's necessary to get a test or get care. If you're severely sick, under any circumstance, you should go to the hospital and get care, because sometimes people need care. And then finally, we are learning from this experience that it's going to take a very integrated approach, because we're going to have outbreaks, if not dengue fever, in the future.
It'll be something else.
Of other diseases.
So our partnerships are crucial. And I'll leave you with one more advice for the public, our traveling residents. Many of us travel. If you travel to an endemic region, one of these countries in the South Pacific, Asia, Latin America, even Africa, where dengue is prominent, or any other infection is prominent, be aware. And if within 2 weeks of your return you become ill with any kinds of symptoms, call your doctor.
Excellent advice. So again, this is a healthcare outbreak and a concern from a public health standpoint, but very practical solutions, mostly about getting rid of mosquitoes, and contacting a healthcare professional will get you through the day. We can get you tests. Department of Health has availability, but so do the health centers, the clinical labs, and your provider. So again, we're hoping by the next time we meet that the dengue fever numbers will have diminished and that we will all be safe. Right now, people are taking it unto themselves, but make sure that if you have a concern, you call the Department of Health or your physician. Thanks for joining us. This has been Josh Green with Healthcare in Hawaii.